afternoon, everyone. It's 2 p.m. and I will start my speech by not thanking the Next Medical Festival organization for placing Daniela and myself just right after lunch, because we all know it's a tricky hour. Many of you are experiencing, this familiar, irresistible post-lunch sleepiness, the time where you are going to not focus anymore on what I'm saying, and I can switch into French pour vous parler des choses magnifiques du microbiote. You won't even notice. And to make things worse, with Daniela, we are going to hit you with data, figures, numbers, KPI. So in other words, the perfect recipe for a collective collapse. No, I'm kidding. You are full of energy, and we are going to show you with Daniela a lot of content, a lot of data, which make echo with your daily activity. But going back to that post-lunch sleepiness, it's normal. It's just biology at work. What you are experiencing now is your gut microbiota, which is working, digesting, fermenting, metabolizing everything you just ate. But your gut microbiota is not alone. Your skin microbiota is also interacting with the air in the room, and your oral, your lung, your urogenital microbiota are engaging billions of interactions deep inside of your body. So the reason why we are here today, and the thing is that you don't have to be, don't blame yourself if you're a bit tired, because as I said, it's totally normal. But the main question is not whether this microbiota influence you, is rather if you are ready to pay attention to them and to understand they can play a key role for your health. And that's the purpose. That's the mission today with Daniela. We are going to show you how medical education linked with microbiota can be a powerful driver for better health by delivering the right message at the right time, in the right way, to the right physicians. And to start the journey, I give the floor to Daniela. Hello, Daniela.
Thank you. Thank you, Olivier. And thank you all for being here. And let's wake up, because we have work to do, right? Because the title is From Clicks to Clinical Change, right? So redefining medical education impact is not easy. So we have to get to work. And basically, my wish for this session is to start elaborating some kind of standards in the sector in order to measure that impact, because I don't want to sit here 10 years from now and having the same question, right, Yassine? So basically, we prepared a very practical session for you today with a case study and how we can do it. We already do it, so it's definitely possible. So basically, yes, before maybe I jump into the slides, I would like to ask you, Olivier, for you, why is it important? Why is it important to measure clinical impact in the day-to-day?
Well, that's a good question, and I will tell you a short story regarding the impact of medical education and the fact that clinical change is not only KPI. We worked with CME with Professor Alessandra Grazzottini, which is a famous Italian gynecologist, and she worked on the session inflammatory pain in the vulvar microbiota. And we managed to reach a specific taboo for women suffering endometriosis. Women suffering endometriosis is 10 years of diagnostic errance, meaning that during 10 years, they are going to the radiologist, to the gynecologist, to the GPs, to the pharmacist, so with not any answer to the. And with that, CME, with that medical education, we managed to gather a huge community, not only of physicians, but also of patients. So that's not KPI, but that's concrete action, and that we can say public health issue.
An impact, definitely. Perfect. Well, thank you for sharing. So here's the uncomfortable truth that we have to face. We cannot measure clinical impact, change in behavior with just, let's say, vanity metrics or clicks, no, as we were saying. Because visibility is the same as in this morning session. Knowledge is not providing value, while visibility is not providing value either, no? For years, we've been measuring in the industry thousands of clicks and views and registrations, but these clicks don't treat patients, right? And changing behavior is hard. It means repetition. We said it also this morning 7 times at least to have an impact. So basically, we have to change first these first metrics. And so the old way would be measuring activity only, and the new way should be measuring value. How we do that? So from clicks, video views, email opens, click-through rate, and attendance to engagement. So we have to define engagement, obviously, but we'll see that in a minute. Application in the clinical practice, trust, we talked about that also this morning, and finally, the impact in the practice. So basically, yes, just for you to understand where we come from, so we try to really represent, we are a medical education provider, Xpeer, and we try to bring the voice of the HCP in the sector. So what they wanted is really, and we also talked about that, something easy to access, so when they have just 5 minutes, so the micro-learning, we also talked about that this morning, learning from their peers, their KOLs, for that trust, and basically on demand, and that was already said this morning. So we bring together, let's say, all the stakeholders. We talked about the KOLs, the industry, because they are supporters, obviously, but the medical societies, even the doctors can publish their content on Xpeer. But for this trust issue, we made an app that is accredited. And that's very important for this authority, let's say, to bring really an authoritative message and bringing that trust. So basically, yes, we create that, and in the first 6 years that we've been around, we try to define and help the sector measuring this impact, and obviously it's evolving, but today I really want you to get at least these top 10 strategic KPIs in mind in order to start with defining this standard. So basically we have quantitative but also qualitative KPIs. The first one I would say is the completion rate. So if we do e-learning, the completion rate of the course. If you do videos or webinar, the completion rate also of these videos. Very important to start measuring this engagement. Then we have the time spent on the message. So for us, it's video. So it's the average watch time, for example. So for instance, on average on Xpeer, it's 36 minutes per doctor. Then we have the opt-ins, very important also, because to bridge the gap between commercial and medical, so it's not providing leads as such, but at least insights, and we talked a lot also about insights this morning. So having the possibility to not only have an engagement, but being able to say, these doctors saw that video, get that diploma, and maybe when we provoke a visit, it will bring more value to the HCP. Knowledge lift is another one. Very easy to measure with a pre and post test. So you ask 1, 2, 3 questions at the start just to measure how do they come to the content, and then the same questions after. And then you can measure if they learned something. Then we start with more sophisticated metrics, the intent to change. This is achieved with a post-content survey also when they state that, yes, I will change something. Obviously, it's an intention. And now, and this is in our roadmap for 26, starting really to, okay, you said you have an intent to change in the future, but did you do it? So we will measure with post-surveys in time, let's say 3 months after, 6 months after, etc., in order to really gather practical insights of, did you see that patient? Did you change anything in your practice or in your prescription habits? So with all that, we start gathering really some interesting KPIs to measure the clinical change. And then we have also, obviously, we spoke about the key opinion leaders or digital opinion leaders, whatever, but it's very important. So what is the satisfaction of the people with this KOL? And because it's very important for trust. And then, yes, we measure social engagement also, and basically the information we don't have as medical education provider is then after, what do you do with the data, and what, let's say, is the connection with the CRM and the visits, but basically this is something we should also interact more on, exchange more information in order to improve. So basically, when you do any activity, I think that it's simple matrix to have is really sustain what works, so what worked well, we keep doing it. If we're missing something, well, that time we didn't have a pre and post survey. Okay, let's do it next time, activate what's missing. refine what's connects, because we need also to understand, and we talked about it this morning, what is the business objective? What is the strategy by the pharmaceutical company to link it to what we're doing? And we say also eliminate what distracts. Because the real questions are physicians applying what they learn? Are they changing their clinical practice? After all, the investments and effort we make as an industry. And now we'll bring this into life with a case study. So I give you the floor to tell about it.
Thank you, Daniela, for this great insight and showing also the recipe of the medical education. And now I'm going to tell you a story, or to give you some concrete example why medical education is crucial for patient health. And why we decided also to choose Xpeer. And that's very important because back in 2021, when we decided to enlarge the scope of the institute and to better reach our physicians, we were not looking for another digital platform. We were looking for a way to deliver credible, updated, reliable, 100% scientifically proven content for the physicians, but that fits also with the daily activity and the constraints. And that's not easy. That's not easy in the competitive environment to find the good app. But few words about the institute. Who are we? The institute, as a mission, is to raise awareness about the key role played by our microbiota. I think you got with the introduction that microbiota is very important on my side. We are operating at an international level. All our content are available into 8 languages, in 30 countries that reach 1.8 million visitors per year, and we got a large community of followers on social media. But for us, which is key, and we need to understand that about medical education, is that microbiota is not just a scientific field. It's a way to help physicians to make better decisions. And that's key. And if we understand that, you will understand the relation between Daniela and myself, or Experience Institute. And that's the reason why also that medical education helps us to build a complementary approach. You see on that slide that the Institute website is not only a website, it's a scientific conference, it's also a Microbiota house in our headquarters in Paris. But on our website, we got 2 complementary approaches. For the lay public, we are more on journey, making them a short introduction about microbiota. And for the healthcare professional, we are more on service approach, meaning our main purpose for the physicians is to help them to better integrate microbiota in their daily practice so that they can pass the information for the patients. So having said that, so you see 1.8 million visitors, but if you got a bounce rate at 80%, it's not worthy. If you got a spend time average less than 30 seconds, it's useless. The only thing that matters is to understand the needs and expectation of your audiences. So both audiences, lay public and healthcare professional. But to understand the needs and expectation, we have to answer a simple question, which is, what do population around the world know about microbiota? It's a simple question, but we realized 3 years ago that we didn't have the answer. So simple question don't have sometimes a simple answer. And to answer this question, we've decided with Ipsos to lead the very first survey dedicated to microbiota, so among 7,500 people in 11 countries. You see the countries, that's a big balance between America, Asia, and Europe, and each year we integrate more and more countries. And this survey, as a mission, is to measure, analyze, compare year after year the level of knowledge of population about microbiota, the expectation, the needs, but also the misconceptions. And you will see that medical education is very important to put back science into the scientific speech. That's key. And I will show you, I'm not going to show you the 40 answers, don't worry, I know that I told you that there will be a lot of KPI, numbers, figures, but I'm just going to show you four figures. The very first question, in terms of awareness, that's the first question of the survey, it's simple. Have you ever heard about the term microbiota? Let's start with simple thing. And you see on this slide that 71% have already heard about the term microbiota. You say, oh, that's great, a lot of people, yeah, thanks Biocodex, thanks Xpeer, we did a great job and so on. But if you look into the details, only a minority know precisely what is behind the term. Only 23% can define what is a microbiota. We don't ask the population to be microbiota expert, but just to define what it is, what is the mechanism, and so on. So there is a gap between awareness and understanding. And to make this gap very few, we need medical education, and that's crucial. And the other question, regarding the healthcare professional, we asked the population, have any of your physicians you have ever seen ever done of the following thing? Alors you see, prescribe probiotic, educate you about the importance, explain to you what the microbiota is. So you see only 2 in 5 of the people interviewed have received explanation from the physicians, meaning that you understand why 23% can define what is behind the term microbiota when they did not receive information from the HCPs. And I'm going to give you another concrete example, which is a health global issue, which is antibiotics and antimicrobial resistance. You know, the WHO, each year during November, leads a great campaign, an international campaign, to tackle this subject. And you can search, and if you go on Google, you search antibiotics and microbiome, and you'll see that a lot of requests regarding the impact of antibiotics on human microbiota. So, and once again, searching is not understanding. Awareness is not understanding. Searching is not understanding. But what is very important, when we ask the question, or that was a false, right and false section, so a lot of sentences that have to choose. 73% of the population, of the global population, know that antibiotics have an impact on our microbiota. And there are a lot of scientific studies showing that there are antibiotics, of course, saving lives. That's the major breakthrough, the medical breakthrough over the last past year. But there are still also something linked with digestive disorders and so on. So 73%. And when you ask them during last time your doctor prescribed you antibiotics, did he tell you that antibiotics could have an effect or negative consequences on your microbiota? You see, a very few minority know about that. And what I want to highlight with that, because antibiotics, I could have antibiotics, I could have also, I talk about endometriosis. We know that endometriosis, there is a 90% of the women suffering from endometriosis, they got digestive disorders. And none of the gastroenterologists can talk to the patients about endometriosis. That's crazy, 19%. So meaning there is room for improvement in terms of communication and education among the HCPs. And that's slide, that's data, that's figures, show you there is room for improvement, and we need to tackle the subject about medical education, because as you've seen on these results, and you can through the questionnaire, you can through the 44 questions of the questionnaire, there is a gap between awareness of the global population and the level of knowledge about the medical community.
Cool. Well, thank you, Olivier. I think that this part was very important, because now we'll see the how-to, really to implement, and we'll share with you the secrets. But the first secret is having done this very good needs assessment by the Biocodex Microbiota Institute, so the why was very clear. Why we are doing that. And then we applied, let's say, the secret sauce that we know is working throughout these years. So basically, the strategy we followed is having this content and the best KOLs, first ingredients, that doesn't appear here, is obviously having an omni-channel integration. So we had the message out there in all the different formats. So we had the support of your website, so the Biocodex Microbiota Institute website. So there is this activation, very important because of the traffic. They have 1.6 million people in that website. And then we had obviously our own channel, Xpeer, with our own, let's say, network. But then we also had this support from WGO, the World Gastroenterology Association. So we had also the medical societies on board. So basically that was key to the success that we'll share after, and the KPIs. Then the accreditation. The accreditation, the role is authority of the message and a reason to click. Because in many countries, obviously, the doctors, they need the points. They need to do it anyway. So having this accredited, obviously, meant a lot for the engagement that we'll see. Multi-language was also key. Your website is in 8 languages, while the medical education we done also is in 8 languages. And having this systematic feedback, analyzing the data, and course after course improving, and also in our marketing strategy. So yeah,
Yeah, that's my sentence, and I read it and I say, yeah, perhaps there's a word missing, and I think you understand, is when education is meaningful, okay, continuous, okay, measurable, you mentioned that, Daniela, but 100 scientifically proven. That's key, and we see a lot of trends on TikTok, on Instagram, and so on, that there are a lot of content spread about digestive disorders and gut health, and when we put back science into medical education, it helps us also to fight this misinformation, and that's very important for us also to put science back in our DNA, because, yeah, medical education can also be a driver to that, and to strengthen, of course, clinical practice, far more than an isolated email ever could. I think you got that point. Today.
Perfect. Well, we saw the top 10 KPIs, so here is how they translate in a project like the Microbiota channel we have on Xpeer. So basically, we are creating a community. This is the first important thing. So almost 10,000 HCPs worldwide are already attending the different courses that we have. These HCP, well, we delivered more than 3,000 diplomas, so that's also a great achievement. Then, with the completion rate, so the video completion rate on average that we have on the channel, we have 7 courses, I think. Almost 8. Soon 8. 87% completion rate of the videos, so that's a deep engagement. And my personal favorite, the average watch time, 37 minutes of watching the videos. This is really the KPI that we measure at Xpeer. As you see on the slide, there is no clicks, no registration. So really, this is when we start measuring on our side. And the knowledge lift I was mentioning. So they had an improvement on average of 17% uplift in their knowledge thanks to the courses we have. The NPS score, I think it was also covered, very important. So 4.6 out of 5 is very high, so we have a great engagement, great satisfaction rate. But for me, the gold KPI, well, not for me, I think everybody's interesting, is the intention to change into practice, which we started also in 25 to measure, and in this case, it's 4.6 out of 5. So what does it mean for you in the day-to-day? Does it change something, seeing this data?
Yeah, it's really changed something, and it's very important. And the number of HCPs that we gather on the Microbiota channel, I think it's a major KPI in terms of success. Because which is very important, we need to stop measuring KPIs only by the click. The main KPI for me as a director of the institute, it's a patient's outcome. It's a better health. It's also better discussion in clinical medicine. That's key, and that is not measurable right now. But when you got patient outcome, when we got HCPs engaging on Facebook, on LinkedIn, because we make a big noise about the CME on LinkedIn, that's a golden KPI.
Totally. So we'll see, just to start, again in 26, or maybe when we come back to Brussels next year, we will present and go deeper with really the intention, and then in the practice, in the real world, what it means for the patient outcomes. What is also interesting, and why I decided also to bring Olivier and the Biocodex Microbiota Institute, is also that this change doesn't happen in a month or in a year. We have really to sustain this, let's say, effort through time. So it's been already 5 years of collaboration with the Institute, so that's also the way we create change through time. It takes a long time, so consider it. And if we see the projection for the next years, it's good, no? It will keep growing, and this is also when we have such a partnership in place that really help doing this change, because change doesn't happen with a webinar or a newsletter. As I was saying, now Xpeer in 26, we reach more level 5 in continuing medical education with this follow-up survey through time, and we'll gather more data, and hopefully we'll be able to present some new data for next year. And before we jump into question, because we have more time than we thought with Olivier, so I hope you will have questions for us, I want also to invite you first, join Xpeer. It's for everybody, not just for the HCPs, the patient, but also the industry, so you can download it and see it. This amazing channel I really recommend. Is really interesting, but we have other 500, 600 courses right now. And basically, we prepared also for you with Zaira and the marketing department a very interesting report if you like this KPI measurement thing. So you can download the full report, how to measure digital opinion leaders effectively in medical affairs. So just scan the QR code, and now we're ready for some questions. Yeah. Microphone.
Hello everyone. I had a question about the number of 4.6 out of 5. How many unique HCPs actually filled in the survey?
Yes, so it's not mandatory to fill the survey, so nothing is mandatory on Xpeer, but I think that we have around 30% of them, answering the survey. Yassine, and then,
Thanks, Daniela. Thanks, Olivier, for the work you're doing as well. How do you drive traffic to the actual courses? Because you did mention LinkedIn, Olivier, but what other tactics are you using to educate then the general population for Microbiota? Are you also doing SEO for specific courses that then leads to Xpeer, or what are your tactics?
Yeah, it's a good question, and I think we are working on the omni-channel strategy, meaning that's a website for the lay public, as mentioned. We got a lot of content, articles, video experts. We got also patients' testimonies, which is crucial also in terms of awareness. We got IBS patients' testimony available on the website. That's for the website, but also an omni-channel on social network. As mentioned, we got a great activation on LinkedIn with the CME courses for the HCPs. We jump from X to blue sky. We made this jump last year, and we lost a big community that was on X, but we have to do that on, because we couldn't stay on X for different reasons you can understand. That was a bit a nightmare to bring back the HCPs community, but it started slowly. And Instagram and Facebook are still like a boomer's social network, but are still working well in terms of engagement, in terms of reach and click. Yeah.
Question here. Yeah. I can see how this works incredibly well for an institution like Microbiota. I think generally, if this was hosted by a pharmaceutical company, there may be a different level of uptake, because people would assume that there is more of a promotional intent behind it, even though it's very clearly medical education. In the experience of Xpeer, how have you got past that perception to help this to be more widely available?
Well, we are independent, we are accredited, we are the only app actually that is accredited by the UMS. So basically, it's unbranded content. So we work, and that has been very important for us, not only with pharma, but also with medical societies. Even the doctors, so KOLs, are publishing their content on Xpeer. We also do some content ourselves, because we know some gaps and nobody's financing it, so we have to sometimes, skills mostly. And basically, the way we tackle it is to have a platform for all the stakeholders to join. In fact, a project also for 26 is having more training for patients also, or the citizen in prevention, for example, not patients yet. Basically, yes. I mean, we have to remain independent. So it's with the accreditation, I think it's a stamp for quality. The HCPs know that there is a filter, that it's non-promotional content, and basically, yes, I think that's the final hook for them to participate.
So thank you again for this presentation. I just had one question, or actually two, which are linked. But we said this morning that change requires to convey several times the message, at least 7, right? You have 7 courses, almost 8. So you're going to get track there. But how do you see, from an adherence perspective of that community, an increase course after course, from a KPI standpoint of view or impact standpoint of view? And additionally, I think as medical affairs, we're often focused on these key SLs and often do forget the GP. So I like that in your presentation, you take this into consideration as the first line treaters. And how do you see then the impact on that split, right? GP specialist?
So to answer the first question, I took the example of endometriosis. I talk about the 10 years to be diagnosis. A concrete example is thanks to the CME made by Professor Alessandra Grazzotin, we reduced by 5 years. So it's not, but we reduced by 5 years. So that's something also the gynecologists and the gastroenterologists that follow the CME courses led by Professor Grazzotin, she was not only talking about endometriosis, but just to give you a concrete number about how it can be a societal impact of the CME. Another great impact is that, as Daniela mentioned, there is a missing opportunity in the medicine and pharmaceutical study in Europe. Microbiome, my daughter, she's in primary, she knew better about microbiota, not because I'm a father, but she knows better microbiota than a second-year student in medicine in France. Just to let you know that there's room for improvement in terms of medical education. And just to answer this question, regarding the public following the CME courses, there are more and more students. There are more and more pharmacists. As Daniela mentioned, it's not reserved to specialties, to high-level gynecologists or gastroenterologists. There are students, there are pharmacists, there are nurses, midwives. So that's, which is clever with Xpeer App is that it's open wide. It's an open door to all the medical specialties. And I don't remember.
Time is up anyway.
Sorry.
I think so. We keep the discussion in the coffee break.
Okay. Thank you so much.
Thank you.